If the patient is not treated, in other words, they do not seek help, or the treatment has not been started by the general practitioner, and they don't come to seek help, then generally over time the actinic keratoses would worsen. So they'd become thicker, and there'd be more of them on sun-exposed sites because that's where they're most common. Occasionally, however, one of the actinic keratoses may turn into a skin cancer, but the rate of change is actually pretty low. With treatment, what we're trying to do is to reduce that risk for that patient. So what I would like to do is to see the high-risk patients and change their risk by treating their actinic keratoses. So for instance, I would like to treat the thicker multiple actinic keratoses in a field area and reduce the number and reduce the thickness of the actinic keratoses, hopefully reducing the risk of squamous cell carcinoma development. The process differs in the treatment phase, but patients are generally referred to me by their general practitioner. I would see them in the clinical setting, I would examine them, and generally we would do a full examination, not just what we could see on visible sites. I would make a clinical diagnosis, and on the basis of that clinical diagnosis I would initiate treatment. The treatment phase, as I said earlier, varies. So for instance, if someone had 1 or 2 thick lesions, I may well treat those with cryotherapy. If, however, they had field change, which is multiple areas of actinic keratoses on a background of photo damage, then I would initiate field-directed therapy. And there are a number of topical creams that one can choose from. So if I was to use, say, one of the creams, Epidix cream, which is 5-fluorouracil, then I would advise the patient to apply this cream. I generally use it once a day, and I would use it over a period of a few weeks. I'd warn them about side effects, of course, and I would see them about 2 or 3 months later. Treatment duration will differ depending on the treatment advised, and another example is photodynamic therapy. That's not a cream as such, that's a cream applied to an area of sun-damaged skin, and then a light is shone onto that area to activate the cream, and thereby this causes destruction of the dysplastic cells. I would actually generally refer the patient to our nurse who does this, and they would treat the patient in their clinic.